This week's Ask Dr. Durie is an important question. After several years of taking Revlimid, diarrhea became a significant problem. How can this be handled? Well, unfortunately, taking Revlimid for several years can result in this troublesome side effect. The good news is that taking Revlimid on a continuous, ongoing basis is very successful and very helpful in controlling the myeloma. The downside is that several side effects, particularly the diarrhea, can emerge over time. So, as the patient asks, how can this be handled? Well, the simplest way is to reduce or modify the dose. This is a side effect which is very much linked to the dose and the schedule of the Revlimid. Conversely, it is quite difficult to stay on the same full dose and try to manage the diarrhea with medications such as Lomotil and different things just to manage the diarrhea. These, unfortunately, don't do a very good job in controlling the diarrhea. So really, the main strategy that can work extremely well is to reduce the dose of the Revlimid. So, for example, in a maintenance setting, if one is taking 15 milligrams each day for 3 weeks out of the month, one can reduce to 10 milligrams, or perhaps from 10 milligrams to 5 milligrams. And this is a sufficient dose to maintain excellent control of the myeloma, but can frequently be enough to eliminate the diarrhea. If that is not a sufficient change, sometimes switching to 2 weeks on and 2 weeks off can be a helpful adjustment, so there is more recovery and rest period for the colon to alleviate the development of the diarrhea. Another way of dealing with it is to have a holiday, to have a period of time where for a month or two the patient can actually be off the Revlimid and then restart at the reduced dose or schedule and then move forward from there. So the good news is that this is typically a very much of a manageable problem with these types of adjustments. But as you could see, this is something that needs to be discussed very carefully with your doctor to make sure that a change in dose and schedule is okay with regard to the status of the myeloma. And so discuss carefully with your doctor. But with these kinds of changes, many times the diarrhea can be eliminated or certainly reduced to very much of a manageable level. So unfortunate that this is a potential side effect, but the good news is that it's typically in the setting of where the Revlimid is working well to control the disease on a long-time basis for frequently many years. So bottom line, an important problem, but very much manageable by adjustment of dose and or schedule.